Dear Atharva batch for an invocation.
A very good morning to one and all. Om Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Jararukbhayam Mrityunasham Dataramisham Vividaushadina.
Thank you, Sri Lakshmi. Hope Lord Dhanvantari has blessed us for a successful webinar. Now I request Shashank N from third year Atharva batch to welcome the gathering.
Happy morning, everyone. Myself, Shashank, student of third year BAMS at GAMC Bengaluru. Hope you all are fit and fine. I feel glad to welcome you all for this webinar session. Firstly, it's a matter of great pleasure and honor for me to welcome our beloved principal, Dr. Ahalya ma'am, the one who always radiates a positive energy, motivating, a great listener, also the one who encourages to bring out the best from students. Ma'am, a warm welcome to you. Next, it's my tremendous honor to welcome our guest speaker for today's webinar, Dr. Suryanarayan Modadla sir, Associate Professor, Department of PG Studies in KAUMARABRITYA, Sri Jagadguru Gavi Siddheshwara Ayurvedic Medical College, Koppal. Sir, a warm welcome to you, and we are really privileged to have you, sir. Without teachers, life would have no classes. With this note, I would like to welcome our guiding spirits, Dr. Raju sir, Associate Professor and HOD, Department of KAUMARABRITYA, GMC Bengaluru, and Dr. Narsimha sir, Assistant Professor, Department of KAUMARABRITYA, GMC Bengaluru. Next, I would like to welcome all the professors of GMC who have joined today's webinar. A strength-based classroom is a place where students with all sorts of labels come together as equal to form a new type of learning environment. With this quote, I would love to extend my warm welcome to all my friends, students of Atharva Batch, GMC Bengaluru. Last but not the least, I extend my warm welcome to all the participants taking part in this webinar session. Once again, I welcome you all for this webinar session, and thank you.
Thank you, Shashank, for your warm welcoming. Now it's time for us to know more about our guest speaker, Dr. Suryanarayan sir. For that, I request Dr. Narsim sir, Assistant Professor, Department of KAUMARABRITYA, GAMC Bengaluru, to introduce our guest speaker in brief.
Thank you, Manjunath. Dr. Suryanarayana sir completed his UG and PG from the prestigious Government Ayurveda Medical College, which comes under Dr. NTR University of Health Sciences, Andhra Pradesh. Sir is presently working as Associate Professor, Postgraduate Department of KAUMARABRITYA at Sri Jagadguru Gavi Siddheshwara Ayurveda Medical College, Koppal, Karnataka. Sir's research topic was Ayurvedic management of Duchenne muscular dystrophy. It's also known as, in a short form, DMD. You will all be very delighted to know that Sir stood first rank in Andhra Pradesh PG entrance test, and Sir also guided up to 20 undergraduate BMS students to achieve good ranks in the PG entrance test, and all these students got seats in various colleges with a very good stipend. Sir is a PG guide and also a clinician working effortlessly on challenging pediatric disorders like cerebral palsy, bronchial asthma, attention deficit hyperactivity disorder, autism spectrum disorders, and issues related to the development of a child. Dr. Suryanarayana sir is also a faculty and board member of European Academy of Ayurveda, EAA, in France. And also, sir is a faculty of AAA UK, Association Ayurveda Academy UK, London. With this brief introduction, I would like to extend my warm welcome to Dr. Suryanarayana sir, for today's webinar. Thank you.
Thank you, Dr. Narsimha sir, for introducing our guest speaker. it's time for us most interesting part of webinar. I request today's guest speaker, Dr. Surya Narayan sir, to begin the session on the topic Kuposhana Janya Vyadhi. Sir, now I hand over the mic to you, sir.
Thank you for warm welcome to introducing me. First of all, I would like to extend my gratitude to Principal Dr. Halia Madam of GAMC Bangalore and Dr. Raju sir, who is one of the senior most faculty in the field of KAUMARABRITYA, who is very the kind and supportive personality, inviting me for this webinar to share my little knowledge with all my dear BMS students, and also Narasimha, Dr. Narasimha, Assistant Professor, Department of KAUMARABRITYA, GAMC Bangalore, and all my dear students. So let me share my few understandings of concepts of Kuposhana Janya Vyadhi, nothing but the Ayurvedic aspect of the malnutrition, I can say. Request Atharva organizer. Who is that? Who is looking after this technical issues? To get my PPT from Narasimha, I'm sending through WhatsApp, as just now I lost power here from my PC.
Yes, sir. Yes, sir. As soon as I get
Narasimha, I'm sending
the
through
PPT.
WhatsApp.
Okay, sir.
Yeah, I will send. I have sent through WhatsApp also now, and also I will send through mail.
Yes, sir.
Okay, so let us talk about the Kuposhana Janya Vyadhi. You know, the Kuposhana a word is the true translated. Okay, Poshana means nothing but nutrition or nourishment. Ku means abnormal. You know that mal means abnormal, or the Sanskrit term is ku. Kuposhana means abnormal nutrition. So the disease is related to the abnormal nutrition. Okay, this is the today's topic. The usually we refers to Kuposhana means always we talk about undernutrition. Undernutrition, but not only the undernutrition, overnutrition also comes under the Kuposhana Janya. But always, many times the Kuposhana comes under, so we always be consider as a undernutrition. Okay, but if you see the literal meaning of the Kuposhana, which includes the overnutrition, that is obesity. Obesity also comes under the Kuposhana. Okay, so as you know, the nutrition is essential for the human, no doubt. Even especially children, they will be having more rapid growth and development, since they require a lot of the nutritional requirement will be there. If at all, due to any reason, they could not able to fulfill the their nutritional demands, and they will be land up in the malnutrition. You know, especially in children, there are 3 age groups. They are more vulnerable for the malnutrition. What are those? Especially the children around the age of 6 months, means infants at the age of 6 months likely to have a malnutrition, because a lot of issues with the complementary feed, how to initiate complementary feed. Though the literates, the parents are literates, but still okay, they do not know what to feed and how to feed, and the children also they will have a difficulty to adopt this mechanism, nothing but from the liquid diet to the semi-solid or a solid diet. Means nothing but kshira is a completely madura ahara, okay, liquid diet, and suddenly they cannot go for the solid diet. And also the taste also different. Kshira is a madura rasa pradhana ahara, whereas the rest of the complementary diet may have amla rasa, lavana rasa, and other remaining five rasas may be mixed with that. So that is the reason where the children usually reluctant to take the feed at the age of 6 months. That is the age vulnerable for the malnutrition. And the second age is age between 1 to 2 years. Age between 1 to 2 years. Okay. I'm also joining with other ID, so please let me in. I have got power here. I can share my PPT. Thank you. Okay, so the second age group is between 1 to 2 years, where the nutritional expenditure is more, or nothing but energy expenditure is more. So though the children are taking, but they will be more playful or more active in that particular age. So that's what, once again, there is a rapid growth and development is present in that area, that particular age, since the children requires more nutrition in that particular age group. So means you can understand, and first two groups are before just below 2 years only. Also
I request you to make me host. Narasimha, please make me host so that I can share my PPT.
Yes, sir. Yes, sir.
Or you can share.
A technical person recording. Hello, Manjunath, tell the person. Yeah, yes, sir. Sir, 1 minute. Tell the person to share the screen or allow sir to share immediately.
Okay, sir.
Okay, third group of children. Mute other persons.
Mute all the participants. Who is doing all this?
Okay. So we are talking about the introduction part. As I told you, the good nutrition allows children to survive, grow, develop, learn, play, participate, and contribute, while malnutrition robs children of their future and leaves young lives hanging in the balance, isn't it? So the nutrition is nothing but nourishment, as I told you earlier. And there are three criteria or particular age groups are more vulnerable for the malnutrition. So the third age group is pubertal age. Especially the girls are more prone to the malnutrition than the boys. Why? Because the girls, apart from their rapid growth and development during the pubertal age, also they will menstrual issues since they require a lot of nutritional energy or requirement. So if at all they did not meet this criteria, and they are more prone to the, that is the reason in children vulnerable to the tuberculosis. TB is more common in young adults and girls because they are more having the nutritional issues. Percent of the and other nutritional undernutrition issues from the is more incidence in that particular age group itself. Okay, and next the same nutrition is nothing but nourishment. Mal means abnormal. Okay, so according to the WHO, the pediatric malnutrition is defined as an imbalance between the nutrient requirement intake resulting in cumulative deficit of energy, protein or macronutrients that may negatively affect growth and development, other relevant outcomes. Okay, so especially there are three things. One, first thing is if the intake is less or maybe the absorption is abnormal, like for example, children are suffering from like grahani, pradushta grahani, abnormal grahani. So the grahani causes the absorption, isn't it? Abnormalities with the grahani. And the third, nothing but malabsorption syndrome. Thirdly, loss of nutrients. For example, the children suffering from the chronic diarrhea. Okay, so any like other irritable bowel syndrome, any loss of kind of loss of nutrition comes under the third cause. Less intake, and second one is a malabsorption, and third one is the loss of nutrients by any other means. So these are the three important factors for the malnutrition in children. So as I told, malnutrition, not only the undernutrition also can be considered as a obesity or overnutrition, because it is the stunning fact that in India there is a lot of gap between the or economical India, the poorer are more poorer and the rich people are becoming more rich. So means there is a lot of gap. So means the rich group of people, especially they are having the overnutrition, and the poor are having the undernutrition. We have both facets, like the nutrition and the undernutrition as well as obesity, both are there. Okay, in the current scenario. So both comes under the malnutrition. So another way, of course, in undernutrition, micronutrient deficiency also comes, like even any minerals or vitamin deficiency also can be considered. So the main three criteria for the malnutrition you can. Nutrition which includes wasting, underweight. Okay, so especially wasting. Wasting means we see the weight for height. So usually the decreased weight for the height, that is called weight. This is seen commonly in a marasmus or any acute malnutrition. We see the muscle wasting, or nothing but wasting of the muscle and fat. Stunting means the height of the child is affected in a chronic malnutrition, especially affected in the chronic malnutrition, especially that the children will be having the low height for their age. For example, the average Indian height at the age of 4.5 years is 100 centimeters, but usually some children, those are having the malnutrition, they will be having the low height that particular age. Then third group is the underweight. This is a low weight for the age. This is commonly what we see, underweight. Okay, so this is the common presentation in many children. So another way, the micronutrient related malnutrition, that is especially the deficiency of the particular vitamins and the micronutrients. Even anemia also comes under this particular group. And the third one is overweight or obesity, and it is a once again it is one of the lifestyle disorder. Also, this incidence is going increasing in India. Okay, which leads to many other complications in the adult. The magnitude view. So why we must know? See, this is the fundamental thing. So whenever you read any subject or any whenever you are going to learn a new topic, okay, you must know what is the why we have to learn this particular topic. You must know the incidence or prevalence of the particular disease, not only this particular disease. Okay, so why? What is the reason why they have given me this topic is okay. So even or Raju sir is working more on the nutritional disorders also. Okay, even we had got support from the government also that we have to do something in this particular area. Why? Because India is suffering from a lot of malnutrition issues in children. So that is the reason why okay we have to have the thorough knowledge about the malnutrition. So almost 149 million children are estimated to be stunted. They are having the stunted growth. You just see that the stunning results. And 45 million were estimated to be wasted. Okay, so means that they are having the severe malnutrition, especially marasmus-like condition, marasmus and KWASHARKIOR. And 38.9 million were overweight or obesity. That means, see that all are having the more significant prevalence in the world as well as in our country. Almost because our country has a lot of population, almost around 132 crore population. In that, almost 30% population, children population is more, and even the main, especially economical inequality. That is the one of the region. India is the first country contributing the more malnutrition cases in the world. Almost around 4% of the deaths among children under 5 years of the age are likely to link it to undernutrition. This is very, very important. The under just causing they're not gaining height or weight. See that if you classify the entire mortality, nothing but death rate under 5 years, usually the children under 5 years mortality, if you see almost now it is around in 2021 it is around 45% of the deaths, but it was in 2014 studies and 2011 studies almost is around 60 plus deaths, means around 60% of the deaths under 5 years only because of the malnutrition. Because the malnutrition can cause the different diseases. Okay, like because the immunity will be goes down and the children may suffer from the different recurrent infections, either maybe respiratory infections or GI infections or maybe CNS infections, which causes the death of the child. So the important, the children are having the malnutrition once again a more country, right? They are more prone to the diseases, especially infectious diseases, and leads to the morbidity and as well as mortality of the undernutrition. So this is the importance that we have to learn about or we have to prevent, or we have to intervene. We have to start our treatment in treating the malnutrition. Okay, see that the same thing. It is in 2003. According to the WHO sources, almost 60% of the deaths because of the malnutrition only. If you see the mortality rate, now in 2001 it is around 45. The common etiological factors why the children are getting the malnutrition. What are the common etiological factors? Like the socio-cultural factors affecting feeding practices. Okay, and sometimes socio-cultural factors, like especially see the traditions or differ from the place to place, race to race, religion to religion. Okay, the feeding practices and all many differs. So because of that, the children are, because of our traditional practices. Okay, some of the malpractices in our traditions or religions may affect the of the child. And the next one is a maternal children born with a intrauterine growth restriction or intrauterine growth retardation. Intrauterine growth retardation or growth maternal malnutrition, one of the factors. Even according to Ayurveda, you know that in first chapter of Kashyapa Sutrasthana, they have mentioned whatever the mother takes nutrition during the pregnancy will be divided into 3 parts. One part for the Garbha, one part for the Sthana or Sthanya Poshana, and one part for the Swa Sarira Dhatu Poshana. So that means the one part of the nutrition is going to the child in the during the pregnancy. So if that nutrition is decreased and further the effects over the fetus, the fetal growth is decreased, usually IUGR children are more likely to have a undernutrition after birth. So that is the reason where we have to go for the maternal nutrition must be ensured. And the infections, the second common cause for the the most common cause in children, like the children, those are suffering from the recurrent infections. If you see the children who is suffering from the recurrent respiratory infections or GI infections, what happens according to Ayurveda? Agni will be hampered, isn't it? After the illness, Agni will be hampered. Agni Mandya leads to once again a low intake of the calories and even low absorption of the calories leads to malnutrition. And the gender discrimination, of course, it is quite common in India. So, you know, most of the people will be having the like in India, most of the parents are having the more children, around five children, 6 children, especially in urban areas, because they will be waiting for the male child. So the male child is more given weightage than the girl child, and okay, so girl children are more neglected. So discrimination is fed. The boys are more fed than the girls, so that is the reason where one of the chance of getting the malnutrition in the urban areas, especially illiteracy people. And the mother's literacy status also important. So if the mother is literate and she will be thinking about the child health and when to start feeding, what to start, what is the complementary feed best for the child, importance of the exclusive breastfeed and all. Okay, so even the needs or even the nutritional which food is having the more nutrition, so and so things will be knowing by the mother if the mother is a literate. So that's what illiteracy is more once again in India. So that is the reason where we have got the more malnutrition. That is one of the contributing factor. You cannot say one particular factor. The multifactorial causes are there in the malnutrition. And another one is nothing but birth interval. Birth interval means, especially according to the WHO, at least minimum 2 years is required. 2 children, between the 2 children, because the maternal nutrition will be good and the child also will be getting proper breast milk from the mother. The birth spacing is maintained. Okay, so sometimes we see in our OPDs like the child is one child will be there on the hand of the mother and another child is brought with some like a KWASHARKIor, very common because they are not maintaining the birth, lack of the knowledge about this. And the poverty and income, this is the inevitable thing, especially in India and other countries like African countries. Any malnutrition in Google and you can find the African children, especially where they are having the more poverty and income issues, so the low socio-economical status is one of the malnutrition. A parental disharmony, this is important. It is a cause. The parents are not having the proper relations and they are quarreling. That disturbs the child. Okay, disturb the child. Though the child is taking the nutrition, if the mentally is not healthy, psychologically is not healthy and happy, so that affects the malnutrition, especially nutrition that leads to failure to thrive, FTT, failure to grow. Nothing but it causes the undernutrition. And the other primary causes, like as I told you, intrauterine growth restriction. The child is suffering from the intrauterine growth restriction and also likely to have a malnutrition. Low birth weight baby or babies also will have a malnutrition. Chances of getting malnutrition, poor breastfeeding and inadequate complementary feeding. This is the problem frequently we see. Many of them, the exclusive breastfeeding of the 10 months or 1 year, lack of the literacy or knowledge about the feeding techniques and methods. So they will be giving exclusive breastfeed may cause the malnutrition, and even also means early introducing complementary feed also causing the malnutrition because of the lack of Agni, early weaning, and leads to malabsorption. And on the improper, inadequate be given after the 6 months. Okay, means one should start after the 6 months. They have to start Phalaparashana or Annaparashana immediately. If they are not doing this, and may land up in the malnutrition because alone breastfeeding is not sufficient. After the 6 months, the feed must be introduced. So that is the reason where if any issues with the complementary feed, the children may develop the malnutrition. A frequent infectious illness, as I told you, the recurrent infections decreased malnutrition. Water and hygiene, this is part and parcel, because the water or the food is not hygienic. That means the chance of getting the waterborne diseases. The children may get frequently dysentery, diarrhea, okay, worm infestations. These due to the improper the sanitation and all leads to the malnutrition. Secondary causes like abnormal nutrient loss. For example, if they get any nutrient loss, excessive loss of the glucose in a diabetic cases, or maybe the excessive loss of protein in the nephrotic syndrome cases, or maybe problem with the zinc or problem with the any nutrient loss leads to the malnutrition. Increased energy expenditure. So as I told you, between 1 to 2 years, or even especially in preschool children, they will be more hyper. They're more, and they easily spend their energy. So that excessive play also causes the more demand of the nutrition. So if they give a rate, the scheduled nutrition may not be sufficient for their and decreased food intake, food fuzziness also there in children. It is common. They will be rejecting most of the food items, and if the children are not, the parents are not having patience and time to feed their children, and the usually children are suffering to going to suffer from the particular malnutrition. Frequently, in the context of underlying mostly chronic diseases like cystic fibrosis of the lung, chronic renal failure, chronic liver diseases, childhood malignancies, congenital heart diseases, muscular diseases like even cerebral palsy, okay, mental retardation, or any developmental disorders also may have, the children may have the malnutrition. This all comes under the secondary cause. Okay, so these are about the causes of the malnutrition. And the next, coming to the class, just in brief, nutrition and overnutrition. Keep it of overnutrition, we are not much stretching that area. Coming to the undernutrition, you have to understand this area. It is very, very important. So undernutrition can be wasting, stunting, and underweight. Stunting and underweight, it is easy. You can understand the weight is decreased to the height, particular age. The stunting means the height is decreased to the particular age. That is comes under stunting. And wasting, this is important. So this usually we discuss under this protein energy malnutrition. Under the wasting, it comes under wasting. So the wasting is two types. Once again, moderate, acute and severe acute malnutrition. We can say the acute malnutrition is two types: moderate acute malnutrition and severe acute malnutrition. So especially the diseases comes here, severe acute malnutrition. SAM children comes under kwashiorkor and marasmus. Kwashiorkor is purely the protein deficiency, whereas marasmus is purely the caloric malnutrition, or nothing but the energy malnutrition. See, we have got a PEM, protein energy malnutrition. A protein malnutrition is nothing but kwashiorkor. Energy is malnutrition is nothing but marasmus. You know, the macronutrients are three types: carbohydrates, proteins, and fats. Isn't it? The protein deficiency leads to kwashiorkor. Especially, we are getting energy from the fats and carbohydrates. That is the reason why the carbohydrate deficiency and fat deficiency both comes under the energy malnutrition or caloric malnutrition. Means even if you see during the breastfeeding, 50% of the calories are coming from the fat present in the breast milk. Okay, so the reason that Ruksadoshi malnutrition, Harsha, they have said. So means divide of the sneha, divide of the fats. Since the fat is giving the 50% of the nutrition for the children. So that's what the fat, the carbohydrate deficiencies both comes under the energy malnutrition or nothing but caloric malnutrition. You must have what is the energy malnutrition and what is the protein malnutrition. Protein malnutrition is nothing but kwashiorkor. The energy malnutrition is nothing but marasmus. Okay, so these are the things we are going to discuss in the next slides. So the importantly marasmus. See, more or less these concepts are mentioned, well mentioned in Ayurveda in ancient ages. Okay, means you can see 5,000 years ago there was a issue of the malnutrition, and even appropriate terms they have used before the modern terminology invented. The term marasmus, okay, nothing but has come from the Greek word, nothing but wasting. Nothing but wasting means emaciation, loss of the muscle and fat from over the bone or over the skeletal system. Okay, the term kwasharkor, see, nothing but it is exactly, not exactly. This is the term is copied from the parigarbhika, parabhava to the garbha. The same thing here mentioned. Okay, parabhava. Okay, to the like parabhava to the child because of the garbha, parigarbhika. Parabhava means defeat, or nothing but insult because the mother becoming pregnant during the lactational period. The same word, parigarbhika word, whatever we have meaning, is comes under the kwasharkor. Okay, the kwasharkor derives from the the sickness of the weaning, nothing but the child is deposed or forcefully removed from the breast milk. So that is called kwasharkor. Okay, so this is about the kwasharkor. Marasmus and kwasharkor both comes under the severe acute malnutrition. So if you know the marasmus or the another classification, based on the weight, according to the IAP, okay, underweight. So we will discuss marasmus and kwasharkor, and next coming to the another thing, that is wasting is over, and the next one is underweight. Underweight means low weight for the particular age, means low weight for the particular age. For example, the average weight of the child at the age of 1 year is 9 kg if the birth weight is 3 kg. So if the child is having less than that, if you think that the child born at the birth 3.3 kg, usually at the age of 1 year, we must have at least 10 kg. Okay, if the child is having at least more than 8 kg, that is more than 80%, that is the normal. The child is having that, for the simple understanding I am telling, the child is born with the 3.3 kg at birth. He must have a triple weight at the age of 1 year, that is around 10 kg. Okay, if the child is not exactly having 10 kg, at least if the child is having more than 8 kg, because more than 80% of the expected weight is considered as a normal. If he is having the weight between the 7 to 8 kg, nothing but 71 to 80% of the expected weight, it is comes under the mild malnutrition. So they have given the grades of the malnutrition. Okay, grades of the malnutrition. And next coming to the grade 2 malnutrition, if the weight is between the expected weight is between the 61 to 70%, that is comes under the moderate malnutrition. Grade 3 means the expected the weight of the child, for example 10 kg or above 8 to 10 kg, but the child is having between the 5 to kg at the age of 1 year, born with a 3.3 kg. That is the example. So that comes under severe malnutrition. Okay, the child must have a 10 kg, but suppose it to be less than 5 kg, nothing but less than 50%, he is considered as a very severe malnutrition. Very severe malnutrition is grade 4 malnutrition. It is applicable for the especially marasmus. Coming to the stunting, nothing but low height for the age. So low height for the age. I will give, for example, age of 4.5 years, the child must have a 100 centimeters. Indian average, okay, in the Indian children, average height at the age of 4.5 years is 100 centimeters. If the child is having about 95 percentile, then we can consider as a normal. If the child height is for particular is age between the 9 to 95% of the expected, then grade 1, and 85 to 89% grade 2, and less than 85%, that is comes under grade 3 malnutrition. Means he is supposed to have 100 centimeters, but he has a less than 85 centimeters at the age of 4 years, either a male, a girl, or female. Okay, so usually girl or male. Growth comes in the latter stage, especially in the chronic malnutrition. Height is not initially affected. Height is affected. Remember, height is affected when it is a persistent malnutrition or nothing but as well as the stunting and underweight. Next, coming to the marasmus and kwashiorkor they have mentioned. So these two are important, marasmus and kwashiorkor in detail, but briefly I'm giving about the understanding of the marasmus. See that you can see Drishyamano Asti Panjara, the child looks like a skeleton, isn't it? Drishyamano Asti Panjara, you can see all the, you can count the all his bones, means the muscle and fat is wasted here, the muscle wasting is present and fat wasting is present. Drishyamano Asti Panjara, it looks like a skeleton. So this condition is called marasmus. And another thing is there is no edema. No edema, and the child is having the weight is less than 60% of his expected, then usually comes under the marasmus. This is the simple the technique to differentiate the marasmus from the other kwashiorkor and marasmic kwashiorkor. Marasmus means nothing but the literal word is a wasting, isn't it? Wasting. So because of the muscle wasting and fat wasting, lack of fat and muscle, the child weight is less than the 60% of the expected. What is that? For example, the child supposed to have a 10 kg at the age of 1 year, but is having the less than 6 kg, is comes under the marasmus. Okay, and even low weight for the height and low weight for the age. Child is alert in the marasmus. One thing, the child is alert. Okay, and the sluggish movements. Child is alert usually because mentally the child looks good, whereas in kwashiorkor the child is mentally disturbed, irritable. Okay, so those differences we will discuss. See, by seeing the image itself, you have to see that this is the marasmus. This is the marasmus. Okay, you can see the muscle wasting is there everywhere, over the face, over the chest. Okay, over the hands, arms are also having the muscle wasting. And the wasting also can be given grades like see, for example, loss of fat from the axil and groin, then usually grade 1 marasmus. The marasmus can be graded based on the waste of the muscle and fat from the particular body parts. This is very, very important. Okay, loss of fat from axil and groin, then grade 1. And grade 2, loss of fat and thigh from the the wasting from the thigh region and buttock region, that is called grade 2. Even if you see the contrary part, in obesity, if you see that the fat is more deposited in the particular areas, that's what that particular fat is reutilized whenever there is a depletion of the nutrition. The same, in the same order, the way the fat deposition takes place in the obesity, in the similar manner, the fat is reutilized when the undernutrition is present. Okay, so the fat first reutilized from the axil and groin region when the child is having malnutrition, and it is persist, then the it takes place from the thigh and buttock region, means the loss of fat from the axilla, groin, thigh, buttocks, then grade 2 marasmus. Grade 3 marasmus, the loss of fat from the chest and abdomen. Chest and abdomen. Face looks somewhat normal. That is called grade 3 marasmus. Grade 4 marasmus, loss of buccal fat. So nothing but buccal fat. It looks like a monkey face. Monkey face seen in a marasmus. Okay, because of the lack of buccal fat. The buccal fat is decreased. That's what the prominence of the maxilla appears like a monkey. The baby looks like a monkey face. Of course, in this case, there is no monkey face. It is once again, you can say it is almost over the chest also decreased in this picture. Almost grade 3 malnutrition. Grade 4 marasmus, especially even the facial, the strengthening of the face also seen. Shrinkage of the facial muscle also. And kwashiorkor, see that here the baby looks more chubby and not actually, because whatever we see, that is called anasarca, generalized edema. The child is having the edema because of the protein deficiency. Okay, the marasmus is energy deficiency, especially caloric deficiency, especially the loss of carbohydrates and fats, whereas kwashiorkor is a because of the protein deficiency. Because the protein is one of the osmotic determinant. The protein is one of the osmotic determinant. Whenever there is a protein depletion in your blood, in our serum, and leads to the leakage of the fluid, interstitial tissues and leads to the edema. So not only in kwashiorkor, if you see the person who is suffering from the anemia, globulin loss of protein, whenever there is a protein loss, either it is a kwashiorkor, either it is an anemia, or maybe nephrotic syndrome. If you see nephrotic syndrome, loss of protein through the urine and leads to loss of protein, okay, through the urine leads to decreased serum albumin, leads to altered oncotic pressure and loss of fluid. Okay, means shift of fluid from the extra into the extracellular spaces. That leads to edema. So this is the ensarca, generalized edema. The baby is not actually chubby. It is not a real muscle and fat. The child is having the more fluid accumulation. This is called ensarca, generalized edema. So edema is important feature in the kwashiorkor. Usually the marasmus comes usually because of the energy depletion. Before 1 year, it is very common. Kwashiorkor is a common age between the age of 1 to 3 years. Okay, so this is about the kwashiorkor. Apart from that, you can see other changes like the hair changes is seen, as well as the depigmentation of skin. Depigmentation of skin, the pigmentary changes of the skin also seen, and moon face, because the facial puffiness, edema. So the accumulation of the fluid over the face also takes place at the end and leads to the moon face. Whereas a monkey face seen in a marasmus and moon face in. This is the basic difference between and kwashiorkor. The kwashiorkor, once again, kwashiorkor is graded based on the edema. Once again, because edema is a prominent feature in a kwashiorkor, and muscle wasting is a prominent feature in the marasmus. So marasmus is graded based on the emaciation. Kwashiorkor is graded based on the edema. If the pedal edema is present, because once again the fluid always goes downward movement. So that is the reason why, first of all, in kwashiorkor pedal edema takes place, and that is called the grade 1 kwashiorkor. And grade 2 kwashiorkor, facial puffiness. Once again, we have got a loose areolar tissue in the face, as well as even the periorbital region. Okay, around the eyes, we have got a loose areolar tissue where there is a accumulation of fluid. The second common most accumulation of the fluid in the face. That is the reason why facial puffiness comes. Then that is called grade 2 kwashiorkor. The child is having the accumulation of the fluid, and even sometimes okay, especially chest wall and back, and leads to the third that is called third grade kwashiorkor. And finally ascites, as well as the pubertal region also there is a, means especially entirely also accumulated with the fluid, especially scrotal edema seen, or the scrotal edema seen in a boys with a kwashiorkor. In a grade kwashiorkor, there ensarca, this condition is called ensarca, all over the body fluid, that is called grade 4 kwashiorkor. Okay, the basic differences, the commonly asked question okay, examination, that is not a point of view. You see here also the basic differences between the kwashiorkor and marasmus. You know, the kwashiorkor is a okay, especially because of the protein deficiency, whereas marasmus more due to the caloric deficiency. It is occur in children between the age of 1 to 3 years. Kwashiorkor, marasmus is a very common below 1 year. It's before 1 year, marasmus is very common. Kwashiorkor is very common between the age of 1 to 3 years. And the subcutaneous fat is preserved in kwashiorkor. Marasmus, especially fat, is not preserved, and that leads to emaciation or muscle wasting. Okay, enlarged fatty liver. Fatty liver is seen in because of the protein metabolism also linked with the liver. So that's what the liver fatty changes seen in a, whereas in marasmus, no liver involvement, no fat liver. The ribs and not very prominent. The edema, okay, emaciation. Whereas in marasmus, you can see ribs become very prominent. In kwashiorkor, if you see psychological things, and in marasmus, the child is alert. Okay, actually more the kwashiorkor child is more irritable than the marasmus child. Coming to the muscle wasting, mild or absent in a Kwashiorkor marasmus, muscle wasting is more prominent. That grading we have already discussed. And poor appetite in Kwashiorkor. You must know why the poor appetite in Kwashiorkor, why not in marasmus. Okay, see in marasmus, energy or the caloric malnutrition, and usually there is no protein deficiency there, the energy depletion is there. So that's what the child will have a compensatory, okay, the hunger more, the voracious appetite, you can say atyagni or pasmakagni will be there for the child, because the cells are demanding the nutrition, cells are demanding energy, so the child will have a very good appetite, so that you can easily manage the marasmus than the Kwashiorkor. Okay, and once again, the poor appetite, why the Kwashiorkor appetite, their enzymes are less, enzymes are made up of the protein, isn't it? Your enzymes, hormones, immunoglobulins. Remember, these three important. Immunoglobulins, hormones, enzymes are nothing but made up of with protein, isn't it? Whenever there is a protein depletion, hormones are decreased. That is the reason why the child will have a mental apathy. The child is lethargic. The child is very irritable. Is not at all happy because of the hormonal changes. And the second one is a enzyme deficiency. The enzymes are low in a protein deficiency. That is the reason why the child is likely to suffer from the poor appetite and difficulty to treat this case. And the third one is a low immunoglobulin. The low immunoglobulin, lack of protein, leads to child is more vulnerable for the recurrent infections in the Kwashiorkor. Recurrent infections are very, very common in the Kwashiorkor than the marasmus because of the three reasons. One is hormone, enzymes, and immunoglobulins are a composition of the protein, nothing but the protein is decreased. All the three components are decreased and leads to the different issues. Okay, another thing in Kwashiorkor, usually we can see the hair changes. I have not mentioned here, but in hair changes, like especially flag sign is seen in a Kwashiorkor. You can see the brown or the graying of hair and black hair, different bands of the hair seen over the scalp. The scalp hair is having the graying and brown, it turns into brown. That's what brown baby, we can say. Kwashiorkor baby also call it as a brown baby, brown hair baby. Okay, hair changes are common in Kwashiorkor. Once again, protein is essential. Okay, in the hair. And another thing is skin changes. Either maybe hypopigmentary or hyperpigmentation are very, very common in Kwashiorkor, not in the marasmus. Skin changes are seen and hair changes are seen in the Kwashiorkor, not in the marasmus. These are the basic differences. At least remember any 10 between the Kwashiorkor and marasmus. Okay, so clinically how to this is very, very important. Malnutrition based on the Wellcome Trust classification. See that based on the weight as well as edema present or absent, you can differentiate whether it is undernutrition, marasmus, Kwashiorkor, or marasmic Kwashiorkor. You have to understand this is very, very key for the learning the rest of the Kuposhana, Janya, Vyadhi. So here, see that the expected weight is more than 80%. Edema is not there, then it is a normal. The child is quite normal. Okay, I told you, like for example, the child must have about 10 kg, but is having above 8 kg. The child is normal, then comes under nutritional status. Okay, so if you see, child age is 1 year, is supposed to have a 10 kg, but more than 8 kg, the normal, that considered as normal. And the weight between the 60 to 80% without edema, okay, the expected weight is between the 60 to 80% without edema, then the child comes under undernutrition. It is a mild nutrition, nothing mild malnutrition. This can be easily corrected in the home-based foods. Okay, when you increase their appetite, increase their agni, and give some brahmana therapy, easily you can treat them. And the third one is the expected weight of the child between the 60 to 80%, but there is a edema present. The edema is present, then always you have to consider as a Kwashiorkor. Remember, edema is one of the important factors to decide whether it is a Kwashiorkor or marasmus. Whenever the edema is present, you have to label it as a Kwashiorkor. If the edema is less than, the weight is, expected weight is between 60 to 80%, without edema, undernutrition, with edema, kwasharkor. Okay, the next important key factor, weight of the child. Weight of the child less than 60% of the expected, and without edema marasmus. Without edema marasmus. To diagnose marasmus, only one criteria. To diagnose marasmus, only one criteria: weight. If the expected weight is less than 60%, expected weight is less than 60%, then you have to consider as a marasmus. And if edema is present, once again, marasmic kwasharkor. If the expected weight is less than 60%, edema is present, then there is a marasmus and kwasharkor, and it is a complicated case, marasmic kwasharkor. So purely based on the weight, you can diagnose weight and edema, presence or absence of edema, you can diagnose whether it is a marasmus or kwasharkor. And apart from the above other clinical features, it is easy to diagnosis and understand the malnutritive disorders if you understand these concepts. And the next, coming to the treatment aspect. So far about the basic understanding malnutrition, underweight, stunting, and marasmus, kwasharkor, and marasmic kwasharkor. And coming to the assessment aspect, it is becoming very like a large. That is the reason why I have cut short this. And see that the management, before management, you have to assess the child whether the child had a undernutrition is not or malnutrition is not, based on the weight. The first and foremost key factor is the weight, and after the mid-arm circumference. Mid-arm circumference. Especially there is a method is called Shakir tape method, and which will have 3 bands of colors, like a green color. Means if you take any measuring tape up to the more than 13.5 centimeter, if you take the mid-arm circumference, the mid-arm circumference is more than 13.5 centimeter, usually the child comes under the green zone, and the child is normal, having normal nutrition. And another thing, the second one is the child is having a the mid-arm circumference between the 12.5 to 13.5, then you have to consider as a yellow. That is nothing but it indicates the moderate malnutrition, or nothing but not mild to moderate. Mild malnutrition, you can say borderline, you can say. The third one is a red line. The child having the mid-arm circumference is less than 12.5, this comes under the moderate malnutrition. If less than 11, then you can consider the severe malnutrition. Based on the mid-arm circumference also, you can decide the malnutrition, whether the child had a severe acute malnutrition is not. You can also, by simple measuring tape, by using measuring tape, by measuring the mid part of the arm, mid part of the shaft, you have to take and measure the arm circumference, so that you can assess the malnutrition. So this is the way, based on the weight and mid circumference. When sometimes height for the stunting, you can consider you can diagnose the malnutrition. And along with that, you can also go for the other investigations like protein, fat, and carbohydrates. The other micronutrients assessment can be done. So after that, we can go for the treatment. Briefly, I will tell you the treatment. Like, first of all, resuscitation. If the child having the severe acute malnutrition, you have to go for the stabilization, or nothing but resuscitation method, revival. So you have to treat the life-threatening condition. If the child had any hypothermia, hypoglycemia, or any recurrent infections, you have to treat them. Means priority based, you have to treat them. You have to stabilize the child, preferably in the first 1 to 2 days. Then you go for the restoration of the whatever the loss of nutrients. Try to restore them in the next 2 to 7 days. And the third one is a rehabilitation, because you cannot correct the malnutrition in an overnight or in a few days. It may require weeks to months to correct the malnutrition. So for that, there must be rehabilitation. Means you have to advise what kind of diet they have to take, and they have to they follow the dietary rules and all, because we have to make some formulas, and we ask them to take. So that is the rehabilitation phase for the undergraduates. And in brief, it is sufficient. The treatment of the malnutrition, resuscitation, restoration and rehabilitation. Resuscitation is nothing but stabilization phase, first 1 to 2 days, and restoration is requires at least 2 to 7 days. Means like nothing but whatever the depletion, protein is decreased, albumin transfer or glucose, giving the glucose to the child, and so and so. Whatever the or hypocalcemia, so the any other micronutrient deficiencies are there, that they can be restored based on the importance base. Next, third one is the rehabilitation. It takes 2 to 4 weeks. Even child may have a recovery after months, not a weeks. Okay, so this is very, very important if the child is severely having acute malnutrition. And what kind of food should be given in the modern science, or maybe in the present scenario? The food must be available. This is important. We cannot say which is available in the foreign that can be taken in India, or in a region to region, place to place. Okay, the state to state, district to district, food habits are changing. So even availability of food also changes. That's what whatever the available food and which is acceptable. This is very, very important. Okay, see for example, the child had a protein deficiency. I cannot advise to take a non-vegetarian diet if the child is born in the vegetarian family. So isn't it? We have to respect their their habits and all. Even acceptable food, based on their customs, and affordable. This is also important. Affordable. See that which is easily available and affordable and acceptable by the family members. So because affordable is always important, the major problem is a socio-economical status, poverty. So if you advise, you ask them to purchase the dry fruits and all, they cannot purchase. You ask them to take a shanga, or you ask them to take a chana, okay, or guda, so which are easily. So that kind of food you have to advise. Even like based on the region, and the food also prepared. For formula feeds are prepared. For example, in Karnataka there is a Davanagere mix. In Davanagere Medical College, they used to prepare the food mix. The routine for means on the calorie requirement based on the weight of the child, the calorie requirement. For example, below 10 years, 100 kilocalories per kg they will be giving. Below 10 kg of the weight, 100 kilocalories for the weight for the kg they are giving. It's almost the 10 kg weight of the child will be requiring 1000 kilocalories of the nutrition per day. So this is the way they take all the nutrients and together they prepare into mix. For example, in Andhra Pradesh or even in Telugu states, Hyderabad mix is present. In Maharashtra, Mumbai mix is present. Okay, so means according to the region availability, and they are preparing not only availability, satmya, which food is satmya for them, such a kind of diet they are advising in the particular area. So okay, this is about the malnutrition in brief. Vyadhi according to Ayurveda. Okay, so before that, there are 10 steps. If you at least you could able to mention in our exams, because you can also write also what is the glucose dosage and all. Okay, and the UC level it is not useful. Just at least you write or by heart these 10 measures. Okay, 10 steps are there for the management of the PEM, protein energy malnutrition. First, we have to correct the hypoglycemia, because hypoglycemia leads to convulsions and even a loss of consciousness and all. So we have to correct the hypoglycemia in the first 1 to 2 days. Hypothermia, because see the children are having these are the complications. They have to be treated based on the priority. That's what I'm telling. Resuscitation, restoration, and rehabilitation, isn't it? Hypoglycemia must be treated as soon as possible. Hypothermia also, because hypothermia leads to low metabolism, because blood cannot release the oxygen. The hemoglobin cannot release the oxygen to the tissues in a low temperature level, leads to the anaerobic metabolism. Metabolism also decreases. So that's what we have to increase the temperature, because lack of the fat. The fat is a thermal insulation, isn't it? The lack of the fat and the muscle and fat, they are having the poor thermoregulation. That's what hypothermia must be treated. And dehydration, once again, dehydration. Okay, must be corrected in the 1 to 2 days. Electrolytes, if they have any, because these are they may cause the severe complications, even a death also. Electrolyte imbalance and fluid imbalance leads to shock. Okay, even as a different the vital organ changes, cardiac changes, brain changes takes place if electrolytes are imbalanced. That's what they must be corrected as soon as possible. Dehydration and electrolytes. Infection to be treated in the first one week, because see, most of the in clinically nobody will come with the malnutrition. For your kind information, the usually children are not brought by the parents when they're that the children are having malnutrition. Most of the parents brought their children with a recurrent infection. They says that, doctor, my child is suffering from the recurrent respiratory infections, or the child is getting the recurrent diarrhea, or even a severe, even we had a cases, 2 cases with a severe marasmus, and the children brought with the rectal prolapse. The reason is the child had a recurrent diarrhea and recurrent respiratory infections. Cough, because of the cough and recurrent diarrhea, increased abdominal pressure, and already there is a weakened muscles because the lack of calcium and potassium in the muscle tones, it is decreased, and the rectal wall becoming weak, and the mucosa, the viscera pushes down to the rectal wall and leads to the rectal prolapse. The rectal prolapse in common because of the malnutrition. Only that, what I mean to say, most of the malnutrition children comes not for the malnutrition, okay, or the nutritional deficiencies. Parents bring their children with other problems like a recurrent infection. This is the first problem. Children visit to the doctor, okay, not for the, they must be identified and treated. What are the infections are common, especially respiratory infection, and the second one is a GI infections. Of course, another important cause is the tuberculosis. You know that the TB is very common in India because of the 50% of children are undernourished. 50% population is having anemia in India. So that is the reason where the tuberculosis is more prevalent. The infection is not prevalent. Undernutrition, when we have got a less immunity, we are more prone to the infections, isn't it? The nutrition plays a role in maintaining the immunity in a higher level. So when the nutrition is decreased, immunity will be decreased and more prone to the infections. So that is the reason where infections must be treated as soon as possible. Otherwise, leads to other different problems. Nutrients, usually not to go for the correction of iron and in the first 1 week, and go for the correction. And also you correct the, if it is any there deficiencies there, to correct it soon. And see, if you understand the feeding, I cannot give a overfeed, I cannot decrease. You have to see their digestive capability, how much they can digest. That you have to assess. Agni you have to assess, and go on incremental basis. You have to give the feeding, cautious feeding. You have to give catch-up growth. See that the children are having the catch-up growth or not, because see, like they gain weight, but they are not like their parallel or peer groups. So usually the children who are suffering from the malnutrition, they will be having the catch-up growth later on. So means they catch their peers, other group of children weight, whatever they have in the particular age, they reaches that catch-up growth. That is also there or not, we have to see. In sensory stimulus, this is very, very important. That's what in Ayurveda they have. See, like as a Ayurvedic pediatricians, we have the better understanding the sensory stimulus. We advise about Abhyanga. The children comes with even a simple malnutrition, not only the cerebral palsy, other neuromuscular disorders. We also go for the sensory stimulus in the form of Abhyanga, or even frequently taking children close to parents. So frequently stimulating them. So because when you make the child happy, when you stimulate them, definitely they will be having a very proper nutrition. So sensory stimulation. In Pakaroga, they have mentioned Raja Taila application. In Bala Shosha, they have mentioned Laksha Taila Abhyanga. Okay, Vachadi Taila Abhyanga. So means Abhyanga one of the important key role in the management of the undernutrition. Not only here, even in preterm babies, you cannot believe. In preterm babies also, neonatologist, a modern pediatrician, they advise a simple coconut oil or nothing but MCT oil, minimal chain triglycerides, MCT oil, usually orally they will be given in a preterm babies and low birth weight babies, as well, especially in the even IUGR babies. Orally they give the same oil, they advise to apply the over the body massage, they do advise. See that in Ayurveda, ages ago they have mentioned about the Abhyanga, it is a kind of sensory stimulation, and prepare for the follow-up. They ensure that they must follow the follow, okay, they must come for the follow-up every time. So this is the way we have to understand the concepts of the malnutrition in brief. Okay, the next part is next coming to the Ayurvedic part. So far, if you have any doubts, we can interact, or we go for at the end discussion session. Okay, next coming to the Kuposhana Janya Vyadhi according to Ayurveda. Okay, it is almost long session. Try to pay attention and try to grasp the things because they are important for your examination, even for the future practice, even for the better understanding of Ayurvedic like nutritional disorders. The Kuposhana Janya Vyadhi are like 4 diseases they have mentioned. It is a true translated word, not required actually. The Bala Shosha, the different references I have quoted here, Ashtanga Hridaya Uttar Tantra they have mentioned. Bala Shosha, Parigarbhika, Ashtanga Sangraha Uttar Tantra as mentioned, and even Madhav Nidana also can get the Parigarbhika reference. In Pakaroga, exclusive contribution of Kashyapa, Pakka Chikisa, dedicated chapter for the Pakaroga, no other author mentioned, and entire malnutrition can be covered under this Pakaroga. Karsha, of course, not only in children or underweight or undernutrition children comes under Karsha. Karsha is not only in children or anyone can experience, even Charaka mentioned, Ashtanindra. Am I audible?
Yes, sir, you are audible, sir.
Yeah, thank you, sir. Because I have lost
So
power.
if you want to take a 5 minutes break, you can give a
No, sir. No, sir, I can, but I think students may require. But let us continue. I request all the students to
Not
pay
an
their
issue,
attention
sir.
for.
Not an issue,
Okay,
sir.
sir.
You can continue. If you are a
Okay,
break,
thank you, sir. No, sir, I don't want any. Just let us continue.
Okay, sir.
Okay, so Karsha in Ashtanindrita Purusha Adhyaya of Charaka, see, we are not much bothering about the disease because exclusively in pediatric concern, we have got references Bala Shosha, Parigarbhika and Pakaroga. Of course, in syllabus they have heard Karsha. Karsha you can get anyway in 3rd year reading the Charaka. Chikitsa also, you can get the references there, even Charaka Sutrasthana you can also get about that. Okay, so let us see one by one, Bala Shosha, Parigarbhika and Pakaroga. So first of all, you try to understand what is the comparison. Okay, this is my just comparison. Actually, what I have learned from my PG guide, who is Dr. N. Krishnaya, one of the senior professor and HOD, retired professor and HOD, Sri SV Ayurvedic Medical College, Tirupati, from whom I have learned these concepts, the comparison of the the tuberculosis, especially Bala Shosha. You know that Bala Shosha, you know already very well. Shosha is nothing but Raja Ekshma. You can say Raja Ekshma is truly compared with the tuberculosis in adults, isn't it? Similarly here, Bala Shosha. Shosha means emaciation or nothing but Shosha means here you can say take it as a tuberculosis, and in children, tuberculosis in children you can say Bala Shosha. See in Ayurveda, Bala Shosha, though it is an infectious disease, or mentioned by Sushruta, also in Sankramika Vyadhi has mentioned, though it is infectious disease and the treatment is not mentioned for the antimicrobial treatment is not mentioned in Ayurveda. They said once you increase the nutrition, the immunity will be normal and the child or the person can overcome the disease. Even you see, we talk about more about nutrition, even Corona time also. Like the person who had a good nutrition and good immunity usually will be having the less severe complications in the corona COVID infection also, isn't it? Similarly, any infection can be prevented or can be eliminated easily when you increase the nutritional status of the individual, isn't it? So that's what the Raja Ekshma can be taken up as a here Bala Shosha, that is initial tuberculosis, not like a complicated or the progressive pulmonary disease, but you can take it as only PPC, a primary pulmonary complex, PPC, or nothing but initial tuberculosis. You can take it as, isn't it? So, for example, if you see the clinical features, let me explain clinical features. This is the third line. Arochaka pratishaya jvara kasasya jayate kumara shushati tata the shushati tata snigdha sukla mukhekshana. If you see, take those clinical features: arochaka, anorexia, pratishaya, rhinorrhea, running nose, fever, jvara, kasasya jayate, cough, and kumara shushati, kumara shoshana. So these are the important 5 features suggest that there is a tuberculosis, initial tuberculosis. Means when the child comes with the initial tuberculosis, as a balashosha. Balashosha can be compared with the initial tuberculosis based on these clinical features. Okay, if you see the nidana, atyaha, swapna sitambu, slaishmika stanya sevinaha. So 3 important nidana they have mentioned. Atyaha swapna, excessive day sleep. Excessive day sleep leads to kapha dosha, prakopa, shroto avarodha, and leads to nutritional abnormality. Okay, kapha dosha, prakopa. And atyaha swapna sitambu, excessive intake of cold water further diminishes the enzymes. Okay, and decreases the appetite and decreased nothing but decreased intake of the nutrition. This is the way modern. Or even if that increases the kapha. Atyaha swapna sitambu, excessive cold water, and another one is slaishmika stanya sevana, kapha dushita stanya. All the 3 nidana for kapha increasing in nature, isn't it? Atyaha swapna sitambu, slaishmika stanya sevinaha. All the kapha nidana, kaphakara nidana, causing the kapha dosha prakopa and leads to what is happening in the samprapti. Okay, shisho kafena ruddeshu. Sisho kafena ruddeshu, srotasu rasavahishu. See that in children, in sisu, especially in infants, sisho kafena ruddeshu, srotasu rasavahishu. In rasavaha shrotas, in rasa dhatu, there is an obstruction takes place because kapha ruddena, kafena ruddha. So the kapha always causes the shroto avarodha, where it takes place, especially rasa dhatu, because the rasa dhatu, it is analogous to the nutrition, isn't it? That's what the nutrition is affected in the balashosha. Okay, this is the way nidana, samprapti, they have mentioned samprapti and samprapti gataka, they have mentioned. And the arochaka pratishaya jvara kasasya jayate kumara shushati tatha snigdha shukla mukhekshana. You can see the pallor over the conjunctiva as well as the facial pallorness you can see because of the malnutrition. So this is about the balashosha. Atyaha swapna sitambu slaishmika stanya sevinaha shisho kafena ruddeshu shrotasu rasavahishu arochaka pratishaya jvara kasasya jayate kumara shushati tatha snigdha shukla mukhekshana. And the next synonyms, synonyms of the synonyms also shushkandi. If at all they ask the question based on the synonyms, also you have to write the balashosha. This is important. Nidana, the same thing I told you. The atyaha swapna, sitambu, and slaishmika dushita sevana. Kapha dosha, dusha is a rasa dhatu or rasavaha shrotas. Samprapti shrota avarodha. This is very, very important because samprapta vigatanameva chikissa. Nidana parimarjanameva chikissa. Nidana parimarjana is chikissa. So nidana parivarjana and samprapti vigatana. Those things you have to keep in mind for the treatment aspect. Clinical features: anorexia, fever, conjunctiva, and above 4 comes under initial tuberculosis. Okay, the complication is shosha. Kumara shushati, shoshana takes place. So this is the brief understanding of Kumara shosha. Okay, so that I told you this can be compared with technically initial TB can be PPC, primary pulmonary complex, or pulmonary primary complex, PPC. Okay, so initial infection of the lung with the tubercular bacilli. No manifest in infants and young children, and silent. It is quite silent. The symptoms, if you see, more or less equal to our balashosha. Mild fever, jvara, anorexia, arochaka. Okay, the weight loss, kumara shushati, a failure to thrive, is there, and decreased activity is present, and fatigue. Okay, so if you see even a cough, dry cough, initially in children, dry cough is seen in tuberculosis. These are the initial tuberculosis or PPC, primary pulmonary complex, because TB also one of the malnutrition disorder, you can say. In malnutrition only, the people are getting the tuberculosis, not by the direct contact. So tubercular organism is available in everywhere, but those are having the low immunity, dhatu kshaya, and they will be getting going to suffer from the tuberculosis. That's what, that way you can consider the Balashtosa as an initial tuberculosis. Next, coming to the treatment aspect. The fundamental treatment is a Shroto Shodhana. This is important. You have to write, don't write this and that, Balya Brahmana, this and that. So very specific treatment you have to write. What is the Nidana and what is the Samprapti? Samprapti is the Shroto Avarodha. So that's what you have to go for, the Shroto Shodhana Chikitsa. In the Stanya Shodhana, Shlaishmika Stanya Shodhana is involved, so that Stanya Shodhana you have to go for. Deepana Pachana, the child is having anorexia, and any initial diseases, there is ama, fever, there is ama condition is there, so that is the reason you have to go for Deepana and Pachana Chikitsa. And finally Brahmana. So the last option is Brahmana. You have to correct all of them: Shroto Shodhana, Stanya Shodhana, Deepana, Pachana. Then finally you go for the Brahmana Chikitsa. This is the way you have to approach the any malnutritive disorder. Okay, then involvement of the kapha is present. And one by one, Shroto Shodhaka Chikitsa. What are the Shroto Shodhaka Chikitsa mentioned? Saindavadi Churna, Saindava, Tripatu, Pata, and honey. See that all the Lekana Dravyas, Shroto Shodhaka Dravyas, Shroto Avarodha will be cleared by Saindava Lavana, you know well, and Trikatu also best kapha, Dosharan, so Shroto Shodhaka, and Deepana, and Pachana. And this is a wonderful combination mentioned. Okay, Bastang Hrodaya, Saindavadi Churna with honey can be given. A Panchakola Asoka Rohini. Okay, Panchakola Asoka Rohini Churna with ghee also can be given. Any one of that. Badari Amlaki, Dhataki Churna with ghee also can be given. Any one of that, not all the drugs, whichever available in our day-to-day practice. Stira Vachadi Grita, this is important. Shrotasham Shodhanam Param. Shrotasham Shodhanam Param. Shroto Shodhan for purpose. The best drug is a Shroto Stira Vachadi Grita. Vacha itself a best lekana. Shroto, okay, Avarodha will be removed by the Vacha. Stira is nothing but Shaliparni. Shaliparni, Prishnaparni, Brohti Dvaya, Brohti and Kantakari. Utpala, Punarnava, Bharangi, Mustapipali. See that there are Tikshna Dravyas, and combined with the some of the Rasayanas like Punarnava. Punarnava is one of the wonderful drug, wonderful Rasayana, which has got a regenerative capacity. Punarnava means new generation, new regeneration takes place, means the cells which are gauze emaciated will be regenerated and nourished properly. The Punarnava is also there. Even a Shodhahara, which is a edema is present in a marasmic KWASHARKIOR and KWASHARKIOR. Punarnava is one of the best drug of choice. Okay, so this is the way Stira Vachadi Grita will be given. Pipali Vardhamana Rasayana. This is the wonderful drug which can be used in all the malnutrition disorders. Pipali, easily available drug. You have to use very cautiously. Even Pipali is best for Kshaya Roga, tuberculosis. Okay, best for Shosha Roga. Pipali Vardhamana Rasayana mentioned in Shosha Prakarana by Kashyapa. Okay, because the Pipali is modern research has also proved that the Pipali is best hepatoprotective as well as the Pipali enhances the availability of the anti-tubercular drugs. Okay, such a wonderful drug. And Pipali Vardhamana Rasayana, Pipali itself a Rasayana, and Balya, Brahmana, and Shroto, Rodhahara. That's what Pipali alone can be given by cooking in a milk. You can give to the child. And in our routine day-to-day practice, we give in daily basis for a few days in ama conditions. When the Agni is low, when the Brahmana is required in chronic diseases, in chronic autoimmune disorders, Pipali is one of the best drug of choice. And Ashwalindaras, nothing but the ghee which is prepared from Nichula, Ashwagandha, Tulasi, Pipali helps in opening the Shrotas. Ashwalindaras also can be given. So this is the way Shroto Shodhan Chikitsa to be done first, then go for the rest of the treatment. And next, the Shoshahara Grita. On the name of the disease itself, they are mentioned. Estimadu, once again, the wonderful drug, Brahmana drug, okay, and it acts as a steroid. And the Estimadu, Pipali, Lodra, Padmaka, Utpala, Chandana. If you see all the drugs, Sitavirya drugs, Upadmala, Utpala, Chandana, all the Sariba, all the drugs are anabolic property. They are having the anabolic property. They enhances the growth and development. This is the various drugs. Then next we go for a Shoshara treatment with the Shoshara Grita. Next Shungyadi Grita, especially if the children having any Swasa, Kasa, okay, Pratishaya like condition, then you can prefer to treat with the Shungyadi Grita. The Shungyadi Grita will have a Karkatak Shungi, okay, Madhulika, the Barangi, Pippali, Devadaru, Ashwagandha, Kakuli, Kshirabala, so and so drugs, Vidari, and Vidanga. And those drugs can be prepared into Grita, and this is used for the treatment of Balashosha. Another combination, Ativesha, you know, Ativesha is a Shishu Baisajya, Shringi, Karkatak Shringi, Pippali. Almost if you see these three drugs are nothing but Bala Chaturbhadras, Musta is missing here, Musta is missing here, Musta, Ativesha, Shringi, Pippali. These four are called Bala Chaturbhadrasa. Even if present stimulus, that's what I'm telling. Vachadi Taila, which will have Vacha Amlaki Shura, Gomutra and Tela Taila, Lakshadi Taila, Laksha Dhadimastu and Tela Taila combination. Okay, so best for Abhyanga. So when you do the massage, okay, when you do the Abhyanga, the oral, it is a kind of sensory stimulation. The child, means the neurohumors will be produced, and the happy hormones will be released, and they enhances growth and development of the child. Not only that, even peripheral circulation also improves. The cellular, okay, nutrition also increases by the Abhyanga, by following the Vacha and Lakshadi Taila. Even externally, they are useful for the Shroto Avarodha will be removed by the Vacha and Lakshadi Taila. Laksha Sandhanakara, you know that once again it conjoins the tissues. The Mala Dharana, it is not having much, we do not know, maybe having this some scientificity, but we cannot understand. They said, we get laugh when you see that the different animal body parts like a crow of the tongue, umbilicus of the pig, and nose of the fox, leg of the frog should be tied to the body parts of the baby. We do not know, maybe it is some kind of a protein which attracts the bacteria or infection, means the bacterial load of the child will be decreased, and means it is diverted to the other flesh, because most of the time, most of the infections are coming from the animals only, because the animal flesh are maybe source of the infection. So means the infection may be diverted to the particular flesh. It is something like okay, offering the Bali like condition, Mala Dharana amulet with the different body parts of the animals mentioned in that area. So this is a brief treatment of the Balashosha. And the next part of the coming to the Parigarbhika. Okay, Parigarbhika. So really, like the wonder when you see the Kwasharkior, Parigarbhika, easily can understand Parigarbhika, brown hair baby, or Kwasharkior. Clearly, you can by word you can compare, not by the clinical features, but by the word. Some of the clinics that the Kwasharkior can be compared to Parigarbhika. Okay, Paribhavakyam cha. They have said Yogam, the Rogam Paribhavakyam cha Inya Tatra Agnideepanam. Roga, this Roga, this disease has come because of the defeat, opposed. The child is insulted by the mother because the mother becoming pregnant, or child is in a lactating period. So how beautifully they have explained about the Parigarbhika here. Okay, the same term, Kwasharkior, already I told you, Kwasharkior means deposed child. Deposed means from the mother's breast. It is not forcefully removing, but forcefully removing, or maybe though the mother is giving milk, but she become a pregnant, whatever she is taking, food is sufficient only for her body growth, for the next baby stanya preparation, and also the garbha portion, not for the existing child. That means it is a kind of insult to the child by the mother. That's what Parigarbhika, the mother becoming Garbhini. Because of that, the child had got Parabhava, defeat, deposed, or insulted. That's what which is called Parigarbhika. Really, it is a very beautifully explained by our Ayurvedic classics about the Parigarbhika. The next, see that here the same, the 4-line sloka, you can read that the Matuh Kunyo Sthayo Pibenapi, Matuh Kumara Garbinyo, the mother of the child become pregnant. The child Stanyam Prayo Pibenapi, the child is occasionally getting milk, occasionally getting milk, though he's getting milk which is not having quality, no quality at all, because the quality and quantity of the milk is decreased once the mother becoming pregnant. The parigarbhika and as well as garbhasa pakaroga can be more or less equal, but garbhasa pakaroga is an advanced stage of parigarbhika, I can say, based on the clinical features. So this is the only nidana. And next, coming to the clinical features, kasa, agni sadha, vamadhu, okay, Tandra, Karsha, Aruchi, Brahmaihi. Tandra, Karsha, Aruchi, Brahmaihi. These are the clinical features of the parigarbhika. Kasa, Agni Sada, Agni Mandhya, Tandra, the like Vamadu, Vami, and Karsha, Aruchi, Brahmaihi. Yujate, Kosta Vruddhyacha, see the Kosta Vruddhi, seen in a Kwasharkar, Kosta Vruddhi, distended abdomen. Yujate, Kosta Vruddhyacha, Tamahu parigarbhikam, which is known as parigarbhika. Matu Kumara Garbinya. You can compare this parigarbhika with the Kwasharkor, no doubt at all. Okay. So this is about the parigarbhika. So in parigarbhika chikitsa they have mentioned Junya tatra agni deepanam rogam paribhavakyam cha Junya tatra agni deepana. What is the line of treatment of parigarbhika is agni deepana. Once you correct the agni and the child takes a proper diet, okay, the proper nutrition, and he will be becoming all right. The first and fundamental treatment for parigarbhika, agni deepana, don't write all vague answers. First parigarbhika line of treatment is agni deepana mentioned in a chikitsa sutra. Okay, and sometimes three important complications will be there in a parigarbhika. One is agni mandhya, agni sada. For that, agni deepana chikitsa. The second one is agni atyagni. There is another contrary word, atyagni, like in initial stage of Kwasharkor, there is a more agni, voracious appetite, because once again there is a compensatory mechanism where the nutritional rich diet should be given, atyagni. And third one is jatili bhuta kesheshu, the hair changes seen in a Kwasharkor, mentioned in modern, even Ayurveda also. Okay, so we have to treat them according to the clinical feature, like Agni Vardhana. The treatment is Agni Vardhana because the fundamental treatment. Then Pachana, we have to go for Pachana Chikitsa. Then Brahmana Chikitsa. Nidana Parivarjana. Nidana Parivarjana means they have to the mother should maintain, or we have to counsel the family members to maintain the birth spacing between the two children at least 2 years. Okay, that we have within our hand, we can prevent the parigarbhika when you create awareness in the society that they have to maintain the birth space between the two children minimum 2 years. It is so easy. One should the counsel to the parents in the surrounding places so that we can prevent the parigarbhika. Well, that is the importance of Nidana Parivarjana. Then coming to the treatment aspect, I told you there are three important things. Agni Vardhana Chikitsa we have to write. That is a Pipali Adidota. Once again, Pipali comes here. Pipali Mulamcha, the Chitraka, Jiraka, Ajamoda, Yavaksha. If you see Chitraka, Jiraka, Ajamoda, all three are best Agni Deepaka, Pachaka. Okay, Chitraka itself Deepana Dravya, isn't it? Deepana, Pachana, Sangrahaniya Dravyas there. And also the Pipali is also Deepana and best Pacha, Vimo. And Yavakshara, Kshara once again increases Agni, no doubt at all. That's what the same column, almost many of the drugs are present in Bonisan. If you see the MRI component is called Bonisan, we have almost all these components. They used commonly to encounter the disturbances in the infantile. Palyadhigrutha is mentioned. And the next, coming to the Atyagni, many children in initial stage of Kwasharkor or initial stage of malnutrition, most of the children will have a Atyagni. It is quite common. For example, you do not have a food now, and after 1 hour, 2 hours, you will have more Agni. But if you leave food for another 5 or 6 hours, you will lose the Agni, isn't it? And hence will not secrete. So that is the way Atyagni will be there. Another complication in a initial Kwasharkor. There you have to give a simple like a Snigdha, Brahmana, Ahara Dravya, like various Lehya, Jivanigana Dravyas, and Kshira, Dhadi. Okay, the dairy products should be given. They are heavy to digest. Even a fatty rich foods to be given. Like other Brahmana Dravyas, they have mentioned Vidari Kanda. So nothing but Guru Santarpana Dravyas. They are Okay, Guru Guna they have because heavy for digestion. In Santarpana property they have Guru Santarpana treatment is given in Atyagni Chikitsa. Okay, by using these drugs. And finally, Jatili Bhuta Kesha means even they have mentioned like the hair which is matted. Okay, matted because of the different causes and made to bath at holy place of the river or maybe the chaurasta, the road cross with the in the road cross areas. Mayarasa, with the Gomayarasa, nothing but the cow dung juice, we can say. So this is the treatment of Parigarbhika. Okay, and the next coming to the important thing that is of Pakaroga, marasmus. Okay, it is purely caloric malnutrition. You can compare with the caloric malnutrition or marasmus because if you see the Vyadhis of Pakaroga, it is equally marasmus. If you see the clinical features, let me explain one by one. The meaning of Pakka, what do you mean by Pakka? Okay, nature gati. See, another important thing I wanted to tell you. If you see the definition of Pakaroga, Balaha Samatsarapannaha Vyadha Balaha Samatsarapannaha. Okay, like means if after the age of 1 year, Padabhyam Yona Gachati, after the age of 1 year, if the child is not able to walk, we consider as a Pakaroga. It doesn't mean that all the other neurodegenerative disorders or muscular disorders, where the child is not able to walk, we have to consider Pakaroga. Pakaroga only you consider when the nutritional deficiency causing the crippling child. Okay, like nature gati movement is decreased. Manda gamane asat vyavahare, the child is having low activities. Okay, low movements. Vikrutanga, crippled child, disabled child comes under the Pakka. Okay. And the another definition, Balaha Sammatsarapannaha Padabhyam Yona Gachati Sa Pakka iti Vijnaya Tasya Vakshami Lakshanam. So they are telling that the child fails to walk even after the age of 1 year, usually we consider as a Pakaroga. This is very, very important. If nutritionally deficient child not able to walk, then only Pakaroga, not other CP or DMD, other cases comes under Pakaroga. This is very, very important for the treatment. The types of Pakka, 3 types are mentioned. Kshirazam Garbhajam Chaiva, Trutiyam Vyadhi Sambhavam. Kshirazam Pakaroga, Garbhaja Pakaroga, Vyadhija Pakaroga. Kshirazam Pakaroga is nothing but Kapha Dushita Stanya Sevana, which is once again whatever the Ashtanga mentioned by the Bala Shosha. Bala Shosha, Slaishmika Dugdetu, Kapha Dushita Stanya, nothing but Kshirazam Pakaroga, one and the same, you can say. And Garbhaja Pakaroga, Parigarbhika, one and the same, you can write, you can learn. Garbhaja Pakaroga and Parigarbhika, both are same, lactating mother becoming pregnant. And third one is a Vyadhija Pakaroga, the child is suffering from the different diseases, Niza Agantu the diseases, the child is orphan, Anatha children, especially suffering from the disease and likely to have a malnutrition, that is called Vyadhija Pakaroga. Marasmus, you can compare. Only marasmus can be compared with the Vyadhija Pakaroga, not entire Pakaroga. Remember, Kshirazam Pakaroga can be like a Bala Shosha, Garbhaja Pakaroga like a Parigarbhika, Kwasharkior. Vyadhija Pakaroga only can be compared with the marasmus or caloric malnutrition. Kshirazam Pakaroga. So this is Dhatri Shlaishmika Dugdhatu Pakka Dugdhyata Sanyitaha. So another important critic they have given here, Pakka Dugdha. Kapha Dushita Stanya, also known as, most of you ignore this word, but it is important. Kapha Dushita Stanya, also known as Pakka Dugdha. Pakka Dugdha synonym for Kapha Dushita Dugdha. So because if the child conjure that, okay, Dhatri Shlaishmik Dugdha to Pakka Dugdhyata Sanyitaha, Tat Kshirapo, the child takes that particular milk. Bahu Vyadhihi, he suffers from Bahu diseases, many diseases, and leads to Karsha. Different chronic debilitating disorders leads to Karsha and leads to Pakka. Pakka means the child cannot be able to walk finally. Okay, this is the way the Pakaroga, Kshirazam Pakaroga comes. And Garbhaja Pakaroga, Garbhini Matrukaha Kshipram Stanya Shavini Vartanat, same like. But here, suddenly the mother stopped the breast milk becoming, because she became pregnant. She became pregnant, so that's what she stopped milk for the existing child. Garbhini Matrukaha, Kshipram Stanyesha, Kshipram, immediately she stopped the milk. That is the region where the child is landing up in Kshiyate Mriyate. The child may have a severe Shina, Shosha, and then Marana, death also occurs finally. The marasmic child may die also. And this is the way the Garbhaja Pakaroga they have mentioned. Next, coming to the Vyadhisa Pakaroga. Okay, due to lack of time, I'm stressing less, but I will explain each and everything. This is very, very important. The Vyadhisa Pakaroga, it is exactly like your marasmus. If you see the marasmus picture, you can see the Vyadhisa Pakaroga. Niza Agantu Bishaiva, Jaradibihi. If the child is suffering from any Niza Agantu the Vyadhi, already who is Anadaha, the child is Anada, the child is Anatha, orphan, who is suffered from the different diseases, and that leads to, because already there is the nutritional deficiency because he is an orphan and also suffering from the different disease. Ultimately, the great nothing but the loss of nutrients or the muscle wasting takes place. Okay, severe acute malnutrition. Severe malnutrition can be compared with the severe marasmus can be compared with the Vyadhisa Pakaroga. See that Anataha Klishate Balaha, because he Anatha and suffering from the different diseases, Klishate, he become Klishya, Shosha. Shina Mamsa Baladruti, he lost his all Mamsa, Bala, he lost his muscle and fat and strength, nothing but immunity, everything is lost. And Juti, even psychologically deprived. Samsuskaspik Bahu Guru. See that Samsuskaspik Bahu Guru. We have discussed muscle wasting takes place in order that axilla, okay, groins and buttocks and all. Finally, the buccal fat. Samsuskaspik Bahu Guru. All the areas becoming Samsuska emaciated. Okay, and Bahu Guru. Maha Udara Siru Mukha. But if you see, the baby head looks large. Maha Udara Siru Mukha. And his Mukha and Sira, Udara looks large. Why? What is the reason? Disproportion of the head and body looks like a Maha Mukha, Maha Sira. It is not a macrocephaly, not a megalencephaly, but head looks like a large size, not actually large size, but when the body proportion is decreased, the body undergone emaciation, the skeleton of the face is not affected. That is the reason where the Mukha looks like a large Maha Mukha, Maha Sira and Maha Udara, because the Udara, the viscera pushes down. Your intestines are so heavy, they pushes the abdomen down. That is the reason why there is a distension of the abdomen seen in the marasmic child. If you see the next picture, you can see that Maha Udara. Okay, usually Maha Mukha, Maha Sira. You see that the head size is very large here. Looks like a large, not large. Even children will have a distended abdomen in this case. Okay, that is the Maha Udara, Maha Mukha. Pitaksha, you can see the conjunctival pallor anemia. Prusitangasha, okay, their loosely body parts are very loose. Drushyamanu Asti Panjara, no doubt at all. They looks like a skeleton. Drushyamanu Asti Panjara. Pramlana Adara Kayasha, because of that region, all now they have explained about the marasmus. In the next coming to the child is crippled, the child is disabled, not able to walk. Pramlana Adara Kayasha, all the lower limbs becoming a wet, because he is not able to walk, he is passing urine and feces there itself. Nitya Mutra Purushakrut is passing urine and feces there itself and causing pramlana, wetness of the lower half of the body. Okay, Nishchesta Adarakaya, lower half of the body cannot able to move. He is not able to move his lower half of the body, lack of the energy. And Pani Janu Gamo Apiva, tripod position, he is moving on his knees, moving on his okay, buttocks is not at all. Pani Janu. And he is using hands and knees, he is moving, not by walking. He is not able to walk. Panijan, Gamo Apiva, tripod position is going on. Okay. Daurbalya, he looks very lean and Daurbalya. Manda Chesta, no movements. That's what Pakka, Nichar Gati. Mandatvat Paribhutakaha. Because of he is a Manda Chesta, no movements. He is surrounded by all the flies, insects and all. Just imagine the child who is not able to walk and passing urine feces there itself, and he will be surrounded by the different flies and infecting the insects. Makshika Krimikītānām is surrounded, Paribhutaka is surrounded by the Makshika Krimikītānām. Okay, Gamyascha Asanna Mrutyaruk. He looks like a nearer to death. He is ready to die. He looks like he is ready to die. Such a beautifully they have explained when the child had a severe acute malnutrition, nothing but a severe kind of marasmus. Okay, Visirna Hrusta Romasha. Once again, the hair brittles and the hair loss also takes place. Okay, Stabdaroma, they lose their curve also. Mahanaka, you can see the hair and it is very common, quietly we hear that Naka and Nakaturuddhi, Kesaturuddhi takes place in a Rajayakshma Shosha also. Even after death also, people say, the science says that Naka and hair grows, because means here the other nutritional parts, body is not growing, but Naka and the proportionately Naka and the Kesa is more growing. Okay, Durgandhi, he looks very having more smell. Malini, Krodhi, important, irritability. The child is so irritable because the child is not able to move. He's seeing the others are very healthy and they're moving and they're doing all the activities, but the child is not able to move and is very irritable. Okay, Krodhi. So important, that simple word, but Krodhi. Okay. And Ati Vinmutra Dushika, so quite common. Whenever the Agni Manda is there, Ama is there, Bahu Vinmutra will be there in Ama condition. So definitely in malnutrition itself, once again they will be having Ati Vinmutra Dushika, Singhanaka Malodbhava, Singhanaka, like frothy malas, they are coming from the nostrils also. Okay, so this is the way the child is afflicted with the disease, many diseases, and leads to emaciation, marasmus, and leads to not able to walk. The crippled child comes under the Vyadhi Pakkaroga. Okay. And the next, coming to the last aspect of the treatment, and treatment aspect is Mridu Shodhana, because Shodhana is mentioned. See, it affects the child as the age of around 1 to 2 years, where you can find the examples of Virechana, Snehapana in this context. Chikitsa, Mridu Shodhana, Kalyanakam Pibet Pakkaha Shatphalam Yadamrutam, Saptaratrat Paramchainam Trivrut Kshirana Shodhayet. You can give Kalyanaka Grata, the Shatphala Grata, or the Amrita Grata for Snehapana for 7 days, and Virechana with a simple Sukha Virechana with Trivrut and milk can be given. Mridu Shodhana, Depana Pachana, fundamental line of treatment, Balya Brahmana therapy, Abhyanga for stimulation, Rajataila they have mentioned. Rehabilitation, one more interesting thing, the physiotherapy is a recent branch, okay, more supported by the modern people. In Ayurveda, rehabilitation is mentioned by Kashipa and Pakka Chikitsa, Trichakram Pakkaradikam, Prajna Silpaka Nirmitam, rehabilitation. We have to make the child to walk by rehabilitating him. We have to train him. The rehabilitation or physiotherapy mentioned in this contest, it is one of the unique reference in the Pakka Chikitsa. Stanya Shodhana, if it is a Kafadushita Stanya or Pakka Dukta. Okay, then birth spacing in Garbhaja Pakkaroga. Okay, so the same thing, the fundamental line of treatment, Kalyanakam Pibet Pakkaha Shatphalam Yadamrutam, Saptaratrat Paramchainam Trivrut Kshidana Shodhahet. You have to go for this is the treatment, you have to write all the students, you have to write in the exam. First line of treatment is this, Mridu Shodhana. Okay, Snehapana for 7 days, Saptaratra with any one of the Grata, then you give the Trivrut Kshira, Trivrut along with the Kshira for a Shodhana. Okay, next based on the same thing I have explained here. Next based on the dosha they have mentioned, it's very clear. Here based on Vata Pradhana is there, you can go for the Vasti, Sneha, Shveda and Udvartana. And Pitta Pradhana is there, Virechana, the same Mridu Shodhana. Kapha Pradhana is there, here not Vasti, the Kapha Pradhana, not Vamana, they have mentioned very simple treatment. Go Mutra with Kshira. Take it just 5 to 10 ml Go Mutra along with the Kshira, because it is one of the best Kapha Shodhaka, Shroto Shodhaka treatment, Kapha Pradhana. Even we give even a Gomutra, we add in many Kapha diseases while giving Vasti. Even internally also in Kapha Zapasmara we give to treat the Shroto Avaroda. Gomutra is one of the best treatment. And next one is dietary enrich. Next we go for the treat first of all the condition, then go for the second part is a nutrition. Okay, Rasna Eshtadi Kshira Prayoga. Rasna, Estimadu, Punarnava, Yaranda, Satapushpa, Trivrut, Siddha Kshira. Okay, you know that Kshira is one of the best drug which has got a regenerative capacity. As the child newborns up to 6 months, exclusively on the milk, their weight will be doubling. All the immune system is enhancing. They are having very good growth and development in the first 6 months. That means the milk alone is having the best regenerative properties. That's what you try to give a diet in the form of milk. That's what I'm telling. Rasna, Estik, Shira Prayoga, and Samskruta, along with the above drugs, also used for the Samskruta of Kshira, Yusha, Mamsarasa. Shali Anna, Grita Thaila. See, for a nutritional supplementation, nutrition is only the supplement, substitute, not the Aushadha. Nacha Ahar Samam Kinchit the basis once again Kashyapa said, no drug is equal to the food. That's what you have to give food, since it is a nutritional deficiency. You have to give a food in a easily manner, easily digestible, absorbable, assimilated manner you have to give. That's what you have to make into Kshira, Yusha, Mamsarasa, semi-solid form. You have to give even a Sali and rice with Grita and Thaila also can be given. Okay, this provides prana, means it gives length, prana, and strength, drives away the disease. Okay, Raja Thaila, which is mentioned in this context, means even earlier you can think of that the VIPs, means the king, the children of the king, also suffering from the Pakaroga. There they used to give this particular Thaila, sensory stimulus. Okay, that increases the Gati, Ayu, Bala, and Sukha Jayate. So that's what Raja Thaila. Alone, sometimes for 3 marks they are asking Raja Thaila, Vachadi Thaila, Lakshadi Thaila. They are frequently asking. So that's what you have to learn the ingredients which are present in the Raja Thaila. Rehabilitation, finally, Trichakram Fakaratakam Prajna Silpika Nirmitam. Prajna Silpika Nirmitam. So means the expert who has prepared this Trichakra Rataka to suit the need of the child according to the height and his disability. One should design and make the child to have a habit of practicing this Trichakram Pakaradakam Prajna Silpika Nirmitam. Okay, Sanair Gruhanita. It is not at a one time. So physiotherapy means it takes time. You know, we used to get a cases of cerebral and other developmental disorders. They used to go for years together physiotherapy. You know that. So means they gradually have to teach the child how to walk and all. Okay, so this is the rehabilitation mentioned or physiotherapy mentioned in the Pakka Chikitsa by Kashyapa. So Karsha, I'm not going to much explain, and because it is available in other Kaya Chikitsa books also. Okay, thank you. I conclude this session by extending my gratitude and thanks to Dr. Raju sir for giving me this wonderful opportunity to share my knowledge with your students. Though the sir is so senior and he can better explain than me, but still I had given opportunity for me to share my knowledge. Thank you, sir. And also my sincere gratitude to Dr. Ahalya madam, who is the dynamic principal of GAMC Bengaluru, for supporting this event. And also extend my thanks to all my dear students for patience, listening, and paying your attention for the entire session. Thank you, one and all.
Thank you, sir. Thank you for the wonderful session. Now the session is open for the questions. Participants can unmute your mic and ask questions or text in the chat box.
Students, you can interact.
Hello, sir. Good afternoon, sir.
Good afternoon.
Sir, it was a wonderful session, sir. You have given us a very detailed explanation about Kuposhana, Janya, Vyadhis, and we're able to know many new things. Sir, I have a question, sir. Hello, is it audible, sir?
Yeah, audible. Tell me.
Yes, sir. Yes, sir. So, like you told about marasmus and KWASHARKIor, like if we analyze the Samprapti or if we analyze the etiopathogenesis, like it's almost both are one and the same. So, can you specify us clinically how we can differentially diagnose both the diseases and some diagnostic tools that can help us?
That I told you, the weight is only the important factor, and edema, isn't it? The weight is less than 60%. There is no edema. You have to diagnose it as a marasmus. Then edema is present if the expected weight is between the 60 to 80% or maybe the less than 60%, you can consider that as a KWASHARKIor. Okay, other clinical you can diagnose it. See, by seeing the marasmus, you can say Drishyamano Asti Panjara, only one word. The child looks like a Asti Panjara, skeleton. So you cannot find, hardly you can find the flesh over the body because the child lives on his own flesh. That is the great compensatory mechanism given by the God actually, because we will not die if you do not have a food in an overnight, or when you have a malnutrition in an overnight. So because we live on our own flesh, this is the great positive compensation mechanism we have in our body. So this is the way easily you can differentiate the marasmus and kwashiorkor. Hope you understood.
Yes, sir. Yes, sir. Thank you, sir. Sir, and in your clinical practice, sir, which is the most like commonest yogas that you prefer, sir? Like which is having more impact on the rasadushti, like which can be given for rasadushti and which has proved to be very effective in curing like balak shaya rogas and all.
See, like actually in day-to-day practice, all the other pediatricians and other practitioners will not get a severe acute malnutrition like marasmus and kwashiorkor. Usually you get a case of undernutrition. Usually severe acute malnutrition is usually referred to the like rehabilitation centers are there in NRHs. Okay, they in every district hospitals there will be the nutritional rehabilitation centers. NRCs usually will be referred there, and because they will be taking the special care. Along with that, even also we prescribe Ayurvedic medicines. Most of the times we treat under nutritional cases or underweight cases where if you suspect the kapha. And I told you, like simple trikatu or pipali churna can be given initially for a few days. Even in a clinical practice, pipali not only kapha hara or soto shodaka, which is also best brahmana. When you cook along with the kshira and which nourishes the cells also. That's what usually is preferred. Or that the Eshtumadu Sadhita, the Grita, which is made available in our hospital, that also we frequently follow, or we use that particular drugs. And if you do not get those drugs, even also you can prescribe like Vyadhi Gruta. In the market you can get Vyadhi Gruta. It is one of the best, the Brahmana drug, and also Ashwagandha Gruta also can be prescribed. And rest of symptomatically we treat rest of the symptoms. And try to increase the, first of all, correct the agni, and also look for any worm infestation, krimhara chikitsa, agni chikitsa, deepana pachana, then shota shodhara chikitsa, then go for the nutritional replacement. In most of the cases in day-to-day practice, just increase their agni, almost all the problems will be solved. Any doubts?
Okay, thank you, sir. Thank you.
Thank you, sir. Thank you. Now we are coming to the end of the session. I request Dr. Raju sir, Associate Professor and HOD of Department of KAUMARABRITYA, GAMC Bengaluru, to deliver the vote of thanks. Over to you, sir. Raju sir.
Sir, thank you. Sir, I'm very sorry, is explained very detailedly about for the Kuposhana Vyadhis. Sir took 1.5 hours to explain without any break. It is a great pleasure with sir is explaining about modern point and everything and Ayurvedic point very detailedly. I think you understand with photos also they'll explain. Sir is a good experience about in the malnutrition and along with disorders of cerebral palsy, neurological disorders, all this. Sir is well versed about all these disorders. And sir is explained their personal. There is a photos also. What I have seen in the photos also. The photos what the clinicals they sir seen and they took the photos and they presented the in seminars. And I'm very happy. Sir is with presenting the all this. And thank you, sir. And with your busy schedules also, they took the 2 hours for the presenting the Kuposhana Vyadhis. And thanks to Halle Madam, she is giving an opportunity to present sir Kuposhana Vyadhis. And thanks to Narasimha, they arranged all this seminar without any disturbance. Here some of the network issues is also there, but he is arranged beautifully. And thanks all my students. Students attending starting, they attended 99 students. Now they will present only 60 students is there. It should not
I
happen.
think all your students are there. Our students only left in between. They have another
Right.
classes.
What happens? So they have a in our there are 100 batch students is there. 30 students they're going for exams.
Okay.
15th their exam is there. So remaining students mostly they are presented.
Okay, sir.
Thank you, sir.
Thank you, sir. It was
So
a great session. Thank you.
we are sending certificate 1 or 2 days afterwards.
It's okay, sir. Thank you, sir. Thank you, sir.
Thanks
You,
for-
Narasimha. Thank you, all the
Thank you,
scholars
thank you so much.
and students.
Okay.
Thank you, sir. Thank you, one and all.
Thank you.